Ashton, I want to speak to you about thrush. Just to explain what it is, it's a yeast infection that develops in kind of a warm, moist environment. And of course, the breast or even the baby's mouth are those sort of areas that it would develop. Um, it's important to treat both mother and baby when they develop it. It can be brought on by the use of antibiotics or other drugs, but it's important to treat it promptly. Now, I know you experienced it yourself, and Sarah developed it first, didn't she?
I did, yeah. Sarah started presenting symptoms of she had white spots on her tongue, and they didn't go away. They stayed for 2 days, unlike milk spots, and she started to get more windy than she had been previously. So I took her to the GP, and she was diagnosed with thrush. And then very shortly afterwards, I developed it, whereby my nipples just became itchy, they became red and sore. And while we had been feeding fine without pain previously, it felt like a bad latch every time that we fed, that basically it was painful to do it.
Yeah, and I mean that nipple tenderness can actually go on to develop into a cracked nipple as well. Some women actually experience deep breast pain after a feed or during a feed. Others feel the pain in the nipple after feeding too. So it can go, can be at the nipple or it can go deeper. So it's important to get treatment, by going to your GP as soon as you notice that there's any thrush present. And he'll prescribe drops for the baby or gel and a cream for you. Now, if the baby has thrush in the nappy area as well, which is quite common, that can be treated too. It's very important to get it treated early because it prevents it developing and getting worse. Also, there's some self-help things you can do, as in washing the nipples with just warm water and air drying them, because then you take the nipple out of the warm, moist environment and allow it to dry out. Changing breast pads frequently as well, because you want to keep it as dry as possible. They're changing the bra every day. Things like reducing sugar and yeast in the diet as much as you can, taking the chocolate out and things like that. So those sorts of things are important to stop it progressing on. Now, if it does continue after you finish treatment, you really need to go back to the GP and get further treatment. He can step it up because it's important to get rid of it. But it can develop at any time. It's not just something that develops in the early stages of breastfeeding. You could be going along breastfeeding perfectly happily, and then maybe at 3 months, 6 months, suddenly you develop some nipple pain or itchiness around the nipple, or even a red rash, or the baby may develop thrush in the mouth. So just to be very aware of that, and also with the washing of the hands, making sure you keep the hands washed after every nappy change, because you don't want to transfer anything on your hands to your breast. So it's just those basic steps will help to clear it. It's straightforward enough to get rid of if you follow the steps. Okay.